All right, this video is going to be on cellular injury. So we're going to look at some of the different causes of cellular injury. So cellular injury occurs at the microscopic and functional levels. Common microscopic abnormalities include cell swelling, so the cell increases in size, a rupture of the cell membranes or nuclear membranes, and then breakdown of nuclear material such as chromosomes, which then distorts the cell shape, disrupts how it works, and that sort of thing. So, with proper treatment, cellular injury can be repaired up to a point, but eventually it does become irreversible, and there is no treatment for that. So, the first type of injury we're going to look at is hypoxic injury. Hypoxic injury is a pretty common cause of cellular injury, comes with a pretty high fatality rate, can result from a decreased oxygen in the air. So if you're in an environment with not a ton of oxygen, the loss of hemoglobin or hemoglobin function. So an example of this would be carbon monoxide poisoning, where we have the same amount of hemoglobin, but it's not able to function as it's supposed to, delivering oxygen because it is now bound to a bunch of carbon monoxide. An overall decrease in the number of red blood cells, um, obviously, shortness of breath caused by a whole host of things, or a loss of cytochromes, which are mitochondrial proteins that convert oxygen to ATP. So that is something that's seen in cyanide poisoning. So normally our body uses oxygen and converts it to ATP, and it does that with this cytochrome. So if we don't have enough cytochromes, this process isn't going to happen. We're not going to get ATP. So even though we have oxygen in our blood, it's not giving us energy like it needs to. Hypoxia has effects on the cells that start to delete some of the things. But after a while, if they're hypoxic for more than a few seconds, they're also going to start to produce substances that can damage areas nearby or far away if they are carried by the bloodstream, which is then a positive feedback cycle, which leads to more cell damage, more hypoxia, and it just kind of snowballs from there. So, the earliest and most dangerous of these substances that it creates are something called free radicals. And we hear about this sometimes when they talk about oxygen toxicity, if you will. So, having too much oxygen, they say, can cause your body to produce free radicals, which can be detrimental. So, that's hypoxic injury. Next type of injury is chemical. So, various chemicals, poisons, lead, carbon monoxide, ethanol, different medications, things like that can injure and ultimately destroy cells. So, commonly encountered poisons would be cyanide and pesticides. Cyanide induces that cell hypoxia by blocking that mitochondrial process that we just talked about. So, it just blocks the cell's ability to turn that oxygen into ATP. And pesticides block a different enzyme, acetylcholinesterase, which prevents proper transmission of nerve pulses. So it has a big effect on our nervous cells. Long-term ingestion of lead, which we know comes from paint, typically leads to brain injury and neurologic dysfunction. Carbon monoxide, we should know the action of, binds to hemoglobin so that our hemoglobin cannot bind to oxygen properly. Low doses of ethanol, such as in drinking alcohol, cause just inebriation, but higher doses can produce severe CNS depression, hypoventilation, which can then sometimes lead to cardiovascular collapse. Some pharmacologic agents are going to produce toxic products when the agents are metabolized in the body, especially in overdose conditions. So, for example, excessive doses of acetaminophen or Tylenol can poison the liver and can eventually be fatal. Next one here is infectious injury, which can be caused by bacteria or viruses. So bacteria destroy the cells by producing either exotoxins or endotoxins, some sort of toxic substance that injures or destroys cells. And when that happens, we are going to get a rush of red blood cells to that site. So if these cells are damaged now here, we're going to get all of these white blood cells coming in to fight off that infection and hopefully kill off whatever is causing that infectious injury. So along with that goes immunologic and inflammatory injuries. So when we have all these white blood cells come in and try to start taking care of this infection, that's going to cause more edema in that area because now we have more fluid going to that area to carry those leukocytes there. And as the body is recognizing that there is an infection, it's going to start producing more leukocytes, more white blood cells to try to take care of that, which is why we always often see a elevated white blood cell count in someone with infection. There are also genetic factors that can injure cells, as well as nutritional imbalances, which can lead to electrolyte imbalances. Physical agents or conditions, it just talks a little bit about apoptosis, which is normal cell death. When cells stop dying off as they're normally supposed to, that's when we can end up with problems like cancer. And that is it on cellular injuries.